the things that people had to tolerate in the past in terms of either decreased function or pain can be relieved now with some of the newer things that are available. Well, an orthopedic trauma surgeon primarily takes care of fractured extremities, both the lower extremity and the upper extremity, both in terms of acute type of injuries, things that may have happened in a fall or an automobile accident, but also more remote types of problems, fractures that maybe didn't heal the first time that they were cared for. Well, it's not just pain, it's also function. And you know, the average fracture is healed in 3 months. And oftentimes whenever you start getting to the point where your fracture hasn't healed within that 3 to 4 month period, then you're starting to deal with a fracture that is problematic in terms of its potential for healing. And that's manifested in lots of different ways. Pain being one of them, inability to use the extremity in a functional way as another. So oftentimes patients will present to me or come to me because they had a fracture that has taken longer to heal than maybe that it should. It's more painful than maybe that it should be, or their extremity is not functioning in the way that they would expect that it should. And I think those are, you know, that general time frame is something that I think people can look at and say to themselves, gee, I should have been healed with this fracture by now and starting to do some rehabilitation. And if not, then maybe it's something that ought to be looked at maybe a different way. Well, some of the technical advances that have impacted how we treat patients are on multiple levels. Some of the simple and most obvious things are some of the surgical instruments and devices that we can use. And by that I mean plates and screws, metal rods. Many of those metals, for instance, have improved. Their strength characteristics are much better than they used to be. The plates now are designed to fit parts of the body much better than they used to be. And those simple changes have really impacted the way that we can manage difficult situations. In addition to that, there's lots of biological advances that have been made in terms of growth factors and bone graft substitutes that we can now use to help stimulate bone healing and take some of these problem fractures that really had difficult solutions before and make them much easier to deal with now. Helping nature take its course indeed. And I always tell patients, you know, we've been healing bones a long time before our medical knowledge that we have now, and it's a lot of my job is just to help them direct what their body is set up to do. Oh yes, it's not uncommon for patients to present with the expectation that they're going to lose their extremity. I have this wonderful story of a gentleman who was a tattoo artist that had broken his leg, and he had had about 4 or 5 different surgeries to try and get his bones to heal. He had multiple tattoos all over his body except for his one leg. And I asked him why he hadn't tattooed that leg, and he said, well, I always thought it was going to end up being amputated because we've never been able to get this to heal. And I had offered him a surgery and was able to successfully get that fracture to heal. And he carried on with his tattooing at that point and was quite satisfied that what he expected the ultimate outcome to be was much better than he could hope for. It is very gratifying to take a patient who hasn't been able to walk on an extremity for 2 or 3 years and be able to return them to a reasonable degree of function and relieve their pain. They oftentimes are unbelievably appreciative and are sort of the surgeon and doctor's biggest champions. The things that we have to offer here at the medical center are really not available in most other medical environments, and certainly benefit our patients in lots of ways. Probably the simplest of which is that we have so many different subspecialists, both in orthopedics and in infectious disease and internal medicine, our anesthesiologists, all of whom are here with a greater understanding of complex problems and are able to offer our patients really a concerted team approach to caring for their difficult problems.